Your birth experience will be more satisfying if you feel confident about the decisions you make during labor. In this chapter, Understanding Medical Procedures, you'll learn what common medical interventions are performed and why, the benefits and risks of each, and some alternatives you can try instead. Every birth experience is different, and no one can predict exactly how a birth will go, so it's best to be prepared. You can create a birth plan that outlines your preferences ahead of time. This will be a good communication tool that guides your decision-making process during birth. It helps you think about the birth experience you want, including how you might handle unexpected medical procedures. Be open to the fact that you might change your mind during labor, or there could be an unexpected medical issue. So it's a good idea to keep your birth preferences flexible. It's important to discuss this with your healthcare provider and labor support team during pregnancy.
And so we might say, okay, we can certainly do that for you, but would you be willing to try this first?
Sure.
Okay?
Okay. You do a birth plan also?
Yeah.
Okay. Great.
Yep.
When you go to the hospital, bring your birth plan and share it with your labor nurses. If a procedure is recommended to you, use the acronym BRAIN to remember what questions to ask before agreeing to it. Find out about the benefits, risks, and alternatives. Then listen to what your intuition tells you about agreeing to the procedure. Finally, ask questions about what would happen if you said no or not now. A week before Nikaya's due date, she develops high blood pressure. Her doctor recommends that inducing labor now is the safest option for her and her baby.
Packed my bags and I mentally prepared myself. Then I went to the labor and delivery and they hooked me up to the monitors.
Inducing labor means using medical procedures to start labor. There are 3 reasons why your caregiver might suggest inducing labor. If your pregnancy continues too far past your due date, if your water breaks and contractions don't start on their own, or if your pregnancy puts you or your baby at risk. There are several medical methods used to induce labor. Sweeping the membranes is one. This is when your healthcare provider separates the amniotic sac from the lower wall of your uterus in an attempt to trigger labor-causing hormones. Another way is using a mechanical dilator, which is a device that is inserted into the cervix and slowly expanded. Your healthcare provider might also insert a ripening agent against your cervix, or give you an IV drug called Pitocin. This medication is similar to the hormone oxytocin, which women's bodies naturally produce during labor and birth. Inductions are more likely to be successful if the cervix is ripe, meaning it's ready for labor. A woman's cervix is considered ripe when it is soft to the touch, starts to thin, and begins to open. Your healthcare provider will examine you to see if your cervix has begun to ripen. Are you ready? Since Nikaya's cervix has not dilated yet, the midwife inserts a cervical ripening agent into her vagina. This is a tablet that will dissolve.
So it's this little tiny pill, and I put it in your vagina towards your cervix, and what it does is help soften your cervix, so that when you do have contractions, your cervix will dilate and open. Okay? We can put that in every 4 hours. You have to stay in bed for 2 hours, because we want it to dissolve and stay in your vagina. We don't want you to get up and have it fall out.
A cervical ripening agent alone might work to start labor, but in other cases, a cervix might not respond to the ripening medication at all. After spending the night in the hospital, Nikaya needs a little more help to get her labor started. So she is now given the IV drug Pitocin. Pitocin might be used after a cervical ripening agent has been given, as in Nikaya's case, or it might be used on its own. You'll learn more about Pitocin later in this chapter. Inducing labor has risks, including an increased chance of cesarean birth, fetal distress, and increased labor discomfort for mom, which may lead to the use of pain medication. Because of these risks, it's best to induce labor for medical reasons only. In general, it's not recommended that women have their labor induced for reasons of convenience, such as wanting the baby to be born on a certain day, or to fit the schedule of a visiting relative. It's also not usually advised to induce labor before your due date, because babies benefit from growing inside of the uterus for 40 complete weeks. No matter how your labor starts, your healthcare provider will keep an eye on your baby's heart rate and the pattern of your contractions. To apply an external fetal monitor, the nurse wraps 2 elastic belts around your belly that hold sensors in place. The top sensor monitors how often you're having contractions, but not the strength or discomfort level. The lower sensor monitors your baby's heart rate. Both sensors are connected to a machine that displays this information and allows you to hear your baby's heartbeat. How often the staff uses these monitors depends on how your labor is progressing. Continual monitoring is only used when medically necessary, so most low-risk mothers will not need to be monitored all the time during labor. When you're being monitored, you may need to stay in a chair or in bed. However, many hospitals have wireless monitors that allow you to move around, which could help your labor progress. Also, some hospitals use a handheld device to monitor your baby. You can ask your labor nurse if the hospital has handheld or wireless monitors. Another way to record your contraction pattern and your baby's heart rate is with internal monitoring. Because this is more invasive, it's only used when it's essential to watch your baby's well-being and your contractions more closely.
So what I'd like to do, if you're okay with it, is try something with a monitor we put inside your uterus to see how strong your contractions are and what's really going on with your contractions.
Internal monitoring gives more accurate information than external monitoring. To monitor your contractions, a small plastic tube is inserted through your vagina into your uterus. To monitor the fetal heart rate, tiny spiral-shaped wires are gently attached to your baby's scalp. Your healthcare provider might use one or both of these, depending on your labor situation. Take note, if your baby's heart rate slows down, you may be given extra oxygen through a mask or nose piece, or you may be asked to lie on your left side, which increases blood flow to the uterus, placenta, and your baby. In this segment, you'll learn about the 2 main types of pain medication used in labor: analgesics and epidural anesthesia. Janine's labor started yesterday afternoon. She labored at home for several hours before it was time to go to the hospital. It's now early morning and she is exhausted and considers pain medication. She requests an analgesic, which is a medication that affects the whole body. It dulls pain sensations, but does not get rid of the pain completely. The analgesic is either injected as a shot in the thigh or buttocks, or given through an IV line.
You probably have just enough time to have 1 dose of some medication in your IV. That will just take the edge off. So it's your choice as far as what you want to do.
So the reason why I was open to the IV drug is because the doctor had said that it was a way to kind of take off the edge. And I needed to take off the edge. And I felt like my breathing was doing pretty good, but it was just so painful.
So after Janine took the IV drug, I experienced her as more calm, more collected. Even though she was still in pain, she wasn't as stressed. So I noticed a difference.
If you decide to use pain medication, there are benefits to choosing an analgesic. You can receive it shortly after you request it, since it doesn't require an anesthesiologist. It offers pain relief immediately and does not numb your muscles, so you can move around after it wears off and push more effectively. However, analgesics also have some risks. They may make you feel drowsy or disoriented, which limits how much you can move around while they are in your system. They can also cause nausea and itching, requiring additional medication. An analgesic may slow down your breathing and lower your blood pressure. This is then treated with IV fluids and oxygen. Another thing to consider is that there are some risks to the baby. Analgesics enter the baby's bloodstream through the umbilical cord. This may cause slow or shallow breathing in the baby after birth. In this case, doctors might give him additional treatment and observe him more closely. Your baby might also be sleepy and less alert at birth, making breastfeeding more difficult. It's recommended that you consider analgesics earlier in your labor in order to reduce these effects on the newborn. For this reason, many hospitals have policies regarding when they allow you to receive analgesics during labor. For Janie, the analgesic wears off and she progresses into pushing and birth several hours later.
Good job. He's coming. He's coming up. He's out. His head's out.
Look down, look down. Open your eyes, open your eyes, open your eyes.
Yeah, look at him. Look at him.
There you go.
Good job.
When the baby came out, it was a relief. I'm like, okay, yes, it's done. We did it.
Oh, yeah.
You know, I wanted to look at him. I wanted to touch him. I wanted to hold him and see if he was okay.
Another effective pain relief option to consider is epidural anesthesia. As you follow Miramar's birth story, you'll learn more about epidurals. She went into labor about 8 hours ago. Now she is dilated to 5 centimeters and requests an epidural.
The reason we chose to get the epidural was just really the exhaustion that I felt, that I had been up the night before with contractions. So I was really tired and I was unable to sleep through them. And we just wanted to make sure that I would be alert and that I would have the strength to, push when it came time to push.
Miramar receives fluids through an IV before getting the epidural. The procedure is performed by an anesthesiologist or a nurse anesthetist and takes about 15 minutes to complete. To start, the anesthesiologist washes Miramar's back with an antiseptic cleanser. Then he injects a numbing medication into her lower back so she doesn't feel the epidural needle.
When they put in the epidural, it wasn't very painful. So I was experiencing some pretty painful contractions, and it wasn't more painful than the contractions.
During the administration of the epidural, I was tasked with sort of staying as a focal point for Marimar, and I was just keeping her focused on, the benefits of what we were doing and why we were doing it, and keeping her excited instead of worried.
This animation shows where the epidural is placed. You can see that the injection site is below the spinal cord, so there is almost no risk of the needle puncturing the cord during the procedure. This image shows you a closer view of the administration area. The center column is the sac that contains the spinal cord and spinal fluid. The gray area that surrounds it is the epidural space. To get into position, you will curl forward or hug a pillow to make more space between your vertebrae, which are the bones of your spine. The epidural needle is carefully placed between the 2 vertebrae and into the epidural space. A catheter, which is a thin plastic tube, is threaded through the needle. The needle is removed, leaving the tube in place. The anesthesiologist then injects a test dose of medication through the catheter. The catheter is taped to Miramar's back, and medicine flows through the catheter. It takes about 15 minutes to feel pain relief. Once the epidural is in place, pain should be reduced by numbing your belly, lower back, and vaginal area. you may still feel a slight amount of pain, pressure with contractions, or pressure on the pelvic floor as your baby moves down. However, your baby won't feel any numbing from the medicine.
And afterwards, the contractions were pretty much back to how it was at the beginning. So I was able to get some rest after that.
Having an epidural brings about an immediate increase in using more medical equipment during your labor. You're continually monitored after receiving an epidural. In addition to fetal monitoring, the staff monitors your blood pressure and the amount of oxygen in your blood for the remainder of your labor. Since your legs might also feel numb, and you may not feel when your bladder is full, you'll need a urinary catheter. This is a flexible tube used to drain urine from your bladder. One downside to having an epidural is being stuck in bed and not being able to use more productive upright labor positions. But with the epidural in place, you can still move from side to side once in a while. Changing positions helps your baby rotate into position for birth. Partners and support people. After the epidural has taken effect, mom still needs your emotional support, so stay close and provide words of encouragement. If she falls asleep, you should also take the opportunity to rest. There are several benefits to having an epidural. It offers very effective and safe pain relief, and it also gives you a chance to rest, which is welcome if you're having a long or difficult labor. Also, the medicine in the epidural does not affect your mental state, so you can stay awake and alert. Unlike an analgesic, the epidural has little known effects on the baby. The most common risks of epidural anesthesia can include shivering, fever, itching, and nausea. You could also experience low blood pressure, which may cause the baby's heart rate to drop as well, but is usually corrected by giving the mother extra oxygen, fluids, or changing her position. For some women, the epidural does not block all the pain. Very rare but serious medical risks are possible with epidurals and are listed on the consent form. Take note, since having an epidural can sometimes affect labor progress, it's generally recommended to wait until you're having regular contractions that are opening your cervix. Once you are fully dilated, it's best to hold off on pushing until your healthcare provider can feel your baby's head in the birth canal. Nakaya's induced labor is now in full swing, and she requests an epidural.
Alright, good to go. Success.
A few hours after receiving the epidural, her labor slows down. Augmenting labor means using medical procedures to cause stronger, more frequent contractions, with the goal of opening the cervix more quickly.
Okay, so you might feel pressure, like touching. Can you feel me touching?
Yeah. Am I doing good?
Yeah, you're 400.
Her midwife suggests breaking her bag of waters to try to strengthen her contractions.
And then I just kind of snag it with the end there, and it pokes a little hole. So you see that little...
Breaking the waters, or amniotomy, is often used to move labor along. It also allows the practitioner to assess the condition of the fluid. Breaking the bag of waters is relatively simple to do and doesn't hurt the baby. To most women, it feels similar to a pelvic exam.
Is it
It's
water?
nice and clear, yeah.
Okay, good.
Did you feel it?
Yeah. Well, I didn't feel it pop, but I felt it come out.
To break the bag, your practitioner makes a small, painless hole in the amniotic sac with a long crochet-type plastic hook. As the amniotic fluid around your baby's head drains, her head drops against your cervix, putting pressure on it. This should help to open the cervix. This added pressure also makes contractions feel more intense. Practitioners generally wait until the head is low in the pelvis before breaking the waters. There are risks for you to consider before agreeing to an amniotomy. First, it does not always shorten labor. Second, once the bag is broken, there is an increased risk of infection. And third, The lack of amniotic fluid in the sac may increase the risk of fetal heart rate issues. Nakaya progresses to the pushing stage several hours after her water was broken.
The bonding experience I had with her after she was born was, like I said, amazing. Just being able to look in her eyes and talk to her and hold her, it was amazing.
I love you so much.
Miramar and Tim were able to get some much-needed sleep after the epidural. After a few hours, the doctor comes in to check her cervix. Miramar has not progressed any more since the last cervical check.
Getting the news that we weren't progressing at the rate that we had thought we would be was pretty frustrating.
And the other option would be starting IV medicine to help your uterus along.
The Pitocin?
If you're okay with it, I would think it would be a good idea to pursue Pitocin.
Yeah.
Miramar discusses the benefits, risks, and alternatives to Pitocin with her doctor.
I was saddened to hear them, when they came in to talk to me about the Pitocin, weighing, the options and considering like what I wanted versus what, is best for me and my baby. We decided to just, go ahead with the Pitocin.
Pitocin, which is also used to induce labor, is a chemical made to imitate oxytocin, the natural hormone that triggers labor. Pitocin is usually very effective at starting or strengthening contractions. A pump controls the amount of Pitocin that Miramar receives through her IV. This allows the nurse to adjust the amount of medication as needed. Your baby's heart rate will be monitored continuously while you are receiving the drug. After several hours, Miramar is ready to push. Miramar's nurse explains how to push effectively with an epidural.
Bear down just like you're having a bowel movement.
We got his head. Oh,
Okay, best push, Mama, best push.
okay.
Go again, Mama, push hard.
Oh my gosh. Oh my gosh, he's up. He's up. We got him.
There you go. Daddy, right there.
Immediately after he was born, I heard him cry, and I did feel that bond, that connection. He was my baby and he was here.
But it was amazing to be as involved as I was, and I don't think I'll ever forget it.
There are some interventions that can help your baby through the birth canal during the second stage of labor if you're too tired, your epidural causes less effective pushing, or your baby needs to be born quickly. A vacuum extractor has a small, flexible plastic suction cup that is connected with a tube to a vacuum pump. Your healthcare provider applies the cup to the crown of the baby's head. The provider then pulls gently on the handle as you push. Forceps are another instrument that practitioners use, but less frequently. The two sides of the forceps fit around your baby's head and can be used to pull and guide him out. The main risk of these interventions is temporary marks and bruising on the baby's face or head. There are other, more serious risks that your healthcare provider will go over with you if a second stage intervention is necessary. An episiotomy is a surgical cut made to increase the size of the vaginal opening. Before performing an episiotomy, a numbing medicine is injected into the area to reduce pain. Since they don't offer substantial benefits in most cases, episiotomies are rarely done anymore. Talk to your healthcare provider about the risks if one is suggested. Take note. You can reduce the chances of needing these interventions if you push in upright positions that use gravity to your advantage and allow your baby's head to slowly stretch the perineum as it crowns. To reduce the chance of tearing, listen to your body's natural urges for when and how to push. Thinking ahead about the kind of labor experience you want, staying flexible, and asking the right questions about medical procedures leads to a rewarding birth that you'll look back on with joy.
Getting the epidural was the right choice because I was able to get some rest. And I knew that when it came time to push that I would be okay.
I don't think I would have did anything differently. Of course, you have to bear some pain to really get the big reward. And it was a huge reward that he was just healthy and nice. And that he did well through the labor just as I came through the labor well, you know? And so I think that is what counts.